and wellness. This is your girl Dominique. I am gonna wait till everybody get in the room before I start. On Friday, I did not have tea time after dark. As they say, I was a little under the weather, so I did not come on and do tea time after dark. But today, I'm going to do a follow up video from the series that we did. We talked about perimenopause and menopause, for women, of course. And we talked about a whole entire 3 day series about it. And I just wanted to come back and follow up with something for the men. Greetings, greetings, greetings. Welcome in, welcome in. Don't forget to thumbs up the live. And if you are new here, welcome. I am Dominique. This is Feminine Health and Wellness. On this channel, we talk about all health, wellness. We talk about the body, the mind, the spirit, the soul, everything healthy, wellness. And we talk about being a better you and a better me. So welcome in. Don't forget to thumbs up the live. And we're going to quickly dive into our topic, and I was just kind of bringing everybody up to date. I talked about a series last week on perimenopause and menopause, and that was my second time coming on talking about it, but I wanted to kind of go back on, re-talk about it. And if you go and watch my video, you will listen to the 3 day series where we talk about, the researches and the changes and all of that kind of stuff. So I kind of wanted to bring it back to you guys. Anytime there is new research and stuff like that, I always try to update you guys on what's going on. So welcome to the live. But today we're going to be talking about a topic for men. We're going to be talking about a topic for men. Since I did perimenopause and menopause, now we're going to be talking about andropause. Andropause is for something that men deal with quietly, silently. I was watching a video, guys, and it was a guy on the video. I think it was on Instagram, and he was talking about andropause and how andropause affected him. And so I was very, very motivated to do some research on it and talk about that. And I know I talked to a friend of mine about it about 30 minutes ago. And I wanted men to be aware of this because a lot of things that men do not know about, because it is not honed in on menopause and perimenopause like it is for women. So I feel like this topic is much needed. The guy that was discussing this particular topic, he really, really felt that if he would have been more aware of andropause, that he probably could have saved his marriage. But at the time, he did not know what he was going through. So I'm going to hone in on this topic, guys. And I want you guys to know that it is real. It is a real thing that men do go through. Okay, so if you want to reach out to me privately, and we can talk about that, okay? I'll be happy to help you and assist you. So, but reach out to me privately. I have an email in my description. Reach out to me privately, and I can assist you as much as I can. Okay. All right. So, let's dive into the topic. What is andropause? What is andropause? What does it look like for men? Just welcome. Today, we're going to, I'm continuing this wellness journey, and we're going to focus on andropause. Sometimes it's called menopause. Sometimes you'll hear it called menopause or male pause or whatever you want to call it, but it is a real thing. But the technical health term for it is called andropause, sometimes called menopause. Just like women experience menopause, men can also have a natural decline in testosterones as they age, often starting in their 30s. All right, often starting in their 30s. Okay, so this is research. I always kind of hone in and try to give you guys some research on it. Um, when does what is hormones in men? Testosterone. What is testosterone? Let me tell you what testosterones are, because I just had a conversation with a friend of mine. So testosterone is the primary male sex hormone. It is a hormone. It is critical for developing male reproductive tissues, but it also affects things like muscle mass, bone density, mood, and even energy level. So it's definitely is a key hormone in men's overall health. It is the key hormone, the only hormone. As you guys know, we as women, we hold both. We have testosterone and we have progesterone and estrogen. We have a lot of stuff going on. But for men, that is their hormone. Okay, so this hormone, as research has shown, this particular hormone start decreasing as early as 35. Male testosterone naturally begin to decline around 30 to 40. I'm sorry, 30 to 40 years of age, right? Or 30. It start declining at anywhere from between 30 to 35. Okay. So on an average, testosterone drops about 1% every year after that. Not every man will experience, but may notice low energy, reducing muscle mass, mood swings, weight gain, and a low sex drive. Okay. So if you are experiencing these symptoms, I am no kind of way a doctor, but go see your physician if you are experiencing any of these symptoms, guys. So I do have a chart that I posted on my community page, and it talks about what age your healthy, what is considered healthy testosterone levels should be at, and go check that chart out. But we're gonna dive more into it. Like I said on this video, the guy was very, very concerned about the andropause because he was having some of these symptoms. He was having some of these symptoms, and it is very, very crucial, guys, that you understand that a lot of these symptoms that men have, they do not openly share these symptoms. Sometimes they're not even aware of this is what they're going through and what their body is going through. It has been shown statistically that it has been a high increase in male suicide rate. And so it is important that you guys kind of tune in if you have a loved one, a male, kind of watch their symptoms, kind of help them be aware of some of these symptoms that I'm going to be talking about. And so we have, it happens to the body. Testosterone levels naturally decline, like I said, 1% every year after the mid 30s. Okay, so this drop can lead to symptoms like I said, low energy, reduced libido, mood swings, muscle loss, and even high risk of cardiovascular issues or depression. So that's where the research come in at. It can lead to depression. In fact, some studies have linked to severe andropause symptoms with a high risk of suicidal thoughts. It is so crucial to recognize these symptoms. when you're in this 32 plus range, start looking and noticing these changes. If your guy is getting um, very, very aggressive or very, very moody, kind of hone in on that. Be mindful of that. If they're tired all the time, if they uh, if you know that your significant other has a high sex drive and then all of a sudden it decrease, you know, immediately, kind of hone in on that, kind of be mindful of that. And so, and seek your physician. How seek your physician. Like I said, I'm not a physician or anything like that, but I am going to tell you some herbs that you can use, some food that you can eat that is going to help continue to naturally produce those testosterone levels that you need to thrive, and to have a more successful life. So when you go into the doctor, guys, so we already know you get your PSA check and all of that kind of stuff, but it is a test. It is a test that you can take that is going to tell you the total testosterone levels that you are, that wherever you are at whatever age. So there is no automatic testosterone test at 40. You need to ask your doctor. See, that's the difference, guys. With women, it's an automatic, right? It's an automatic when you're going through menopause, when you're going through perimenopause and stuff like that. It's like a known thing. Your doctor just kind of give you the test to check to see if you're going through it, to see what your hormone levels are, and then they begin to treat you, or naturally treat you, or however you choose to be, treated during that time. But just listen to this. You need to ask your doctor. Ask your doctor for the test. You have to ask. You're likely to this particular test is going to be given in the morning time. The doctor in the research says that it is best to have it done in the morning time. You're going to check your morning total testosterone along with other hormones like at your LH hormones, your FSH hormones. Those are the hormones. So remember, it is not just about the blood work. It is about how you feel. Sometimes you feel these symptoms before you're actually, hi, Mary Life Journey. We're talking about andropause today. I'm trying to help the men out, just like I had the whole series about menopause. We're talking about andropause. It has been research and studies showing that it is a high rate of suicide in males that are going through andropause. Andropause is another name for male menopause, right? So these tests have to be asked for. So when think about how you're feeling, even though your test may not read that you are in andropause, sometimes you have to also think about how you're feeling. Do you feel like you're being, you're depressed? Do you feel like you have that low energy? Do you feel like your libido is going down? So it's all about how you feel, because I can remember when I was going through perimenopause, I could feel the symptoms before my test actually read that I was in perimenopause. So I guess that's why they said the research says it's all about how you feel. If you're feeling a certain kind of way, I know feeling is not a good word for me, but if your body is feeling a certain kind of way, if you're feeling these mood swings, extra over the top mood swings, you're exercising and you're losing muscle mass, just kind of think about that. And so ask for this test. It is not a test that is generally given unless the male go to the doctor and ask for the test. It is a blood test. They are going to give that blood test, and they're also going to check your LH levels, your FSH levels. Those are the levels they're going to be checking as well. So I'm just kind of giving you guys a little tidbit of information, some things to expect. So beyond the testing, I always talk about this on this channel, guys. I can give on the herb. You can go to the doctor and get prescription medicine. You can do all of that, but you also have to have a life-changing experience. It's not just about the herbs. It is not just about the medication or whatever it is that your doctor give you. You have to change your lifestyle. It is a huge role. How can you, as a male, continue to produce the testosterone that you need to live a healthy, vibrant life? I'm going to tell you, stretching, training, light weight lifting is going to help boost testosterone. Okay, so those are some of the key things that you could do. I know a lot of men lift a lot of weights and different things like that. I am really not sure what their testosterone levels are, but research study is showing that lifting weights is going to help boost the testosterone. Okay. Now, when it comes to the cardio, remember I said that earlier, one of the symptoms is risk of cardiovascular issues and depression. So you got to keep in mind with that too. So the cardio is important. You want to do the weight lifting. You're going to do some cardio. It's going to support the hormone balance. Okay, of course, you're going to change your diet. Integrate healthy foods that is going to help boost your testosterone, which is going to be zinc-rich foods, oysters, which I didn't know that, guys. So I know a lot of men love oysters. That is going to help boost your testosterone. Raw oysters, however you can get it in, that is going to help. I don't care for oysters, but I don't have that to worry about. But however, that's going to help men to produce more testosterone. Vitamin D, such as salmon, and you're going to do magnesium. Magnesium comes from leafy green vegetables. So you're going to change your lifestyle. You're going to eat better. You're going to exercise better or more, I should say. And don't forget good sleep and stress management. I know that some men can have very stressful jobs. Some men work very long hours, 10 and 12 hours. Learn how to, get rest. Try to get some rest. That is going to be critical during this process as well. Don't just go to the doctor and ask for the PSA. That is important to get your prostate checked. That is awesome. That is awesome. But hi, welcome in. That's awesome. But also ask for the testosterone level test. Ask for the test. Get tested. Know where you are mentally. Remember I said on this channel, we always talk about your physical, your mental health is always important. So now we're talking about mental health because it has been showing in the research that men are having a higher rate of suicidal rate because they are unaware of any of this. A lot of men do not know anything about andropause, male menopause, or anything like that. So they are going through these symptoms silently, thinking that they may just be stressed out or their life is just lifing, but they're actually going through a life-changing experience just like women do. But ours is called perimenopause and menopause. So just keep in mind that this is just a natural way of life, a natural journey that we're going to all have to go through and stuff like that. It's not something that you're going to be like, oh, I'm a lesser than a person or being because I'm going through this. But it's like I said, let's go back. Research study is showing that your body naturally start decreasing testosterone at the age of 30. So this is just a natural body process, But can something be done about it? Yes, continuing to eat healthy, continuing to go to the doctor and get your hormones checked, exercising, get off the couch, go for a walk, add some, weights to your, what do you call it, your regimen, far as exercise regimen. And I know sometimes that is very, very easy for men to add those weights to their, their regimen and stuff like that. So just keep in mind that that is going to help increase your testosterone level. Okay? Like I said, I am not a doctor. Always, seek your physician. They can check those hormone levels. They can make sure that you are good. Let me tell you what the chart says. So, as a high level of testosterone, when you are, I guess, at your peak as a male, is going to be. Let me look at my chart here, guys. It's going to be healthy testosterones, anywhere from 300 to 1,000. That's however they rate that. As a from 20 to 29 years old, it's going to be 300 natural high level of testosterone levels, 300 to 1,000. So as you age and you get older, from 40 to 49, it starts decreasing. That's like we said. It's going to be anywhere from 250 to 916. And then as you get older and older, from 50 to 59, it's going to be 215 to, this is just ranges, guys. So keep in mind, it can range. It does not mean that this is what your testosterone level is going to drop to when you reach this age, because you could be very well a healthy 50-year-old man, exercising, watching your diet, adding a little cardio and weightlifting and different things like that, and you can have a normal testosterone level of 1,000. So it doesn't mean that this is what it's going to drop to when you get in this age range. This is just a scale, that a medical scale that is given if at a decreasing rate. Once you start at 30, every year it decreased 1%. This is without, probably, I'm just speculating, with not so healthy diet or not so healthy exercise regimen and different things like that. And so a lot of men, even though you may be a small frame man, you still need to integrate weight lifting in your regimen, because that is going to continue to build that testosterone. I know a lot of older men don't like to lift a lot of weight, and some do, but just keep in mind that it's going to help build your testosterone, and also integrating that healthy diet and exercise regimen. Okay. So, do anybody have any questions? Because I can answer a few questions, regarding the chart. Is there any male in here experiencing? If you think that you are experiencing andropause, I know a lot of men like to. I know it's not funny. Suffer in silence. They don't want to admit that they are going through anything, or they're having brain fog. Brain fog was one of the things or signs or symptoms as well for andropause that men experience. So let me go back over the symptoms. It is going to be decline in testosterone. It's going to affect the male's energy, the mood swings or mood, muscle strength, sexual health, and overall well-being. And that is just some of the symptoms, but it is a known fact that brain fog is one of the symptoms, right? So, as testosterone declines, some men may experience some other fatigue, ED, which is erectile dysfunction, difficulties in concentrating and brain fog, sleep disturbance, and you're going to have some men, not all, is going to have reduced bone density. Okay, and of course, you're going to have that increase of body fat, especially around the abdominal area. Okay, so everything is preventable, guys. If you just continue to move, keep your body moving, live a healthy lifestyle to the best of your ability, I think you will be just fine. Just fine. I don't think it's something to, stress out about or anything like that. But on my channel, we do use herbs, and some of the herbs that can help support men's health and testosterone levels is going to be one of the number one that I researched and found. It's a lot of herbs that is going to help testosterone levels, but um, ashwagandha is one of the top herbs, guys, that is going to help with testosterone. Now, I have taken ashwagandha. I'm not a man, but it relaxes you. It puts you in a relaxed state. It doesn't put you to sleep, but it does help reduce stress, and it puts you in a relaxed state. So, ashwagandha has been shown to increase testosterone and boost vitality. That is amazing. When I did that research, that was the number one herb that they was recommended. Now, there are many, many herbs out here that is going to help with that, but that is the number one. Okay. Fenugreek. Fenugreek may support testosterone as well. I haven't never used fenugreek for anything, but I'm just kind of giving the FYI out there. Research suggests that these can be helpful. Okay, these can be helpful, and it is best to start with one herb at a time. See if that works for you, and move on to another herb. But most definitely consult your doctor, and see if they can come up with some type of. If you prefer to do herbs, on this channel I'm always talking about herbs, but I feel like that is a natural, healthy way. But it is your choice if you want to go and get the pharmaceutical drugs. That is up to you. But another herb is called, which I've never heard of this herb before. It is called red ginseng, and it's going to help with the male vitality. So that is another one that is very, very helpful as well. And so write these herbs down, go to your local herb shop, or guys, you can reach out to me. I do have herbs for men. It is called the stimulator. The stimulator is going to help with ED. It's going to help with your libido, and it's also going to help to prevent any type of male issues. Okay. Now, like I said, my herbs are not the herbs of be all, do all, miracle herbs. You still have to integrate being healthy, changing your lifestyle along the way. Okay. So if you're having any type of male issues or anything like that, you can reach out to me. I can do a consult. I can do a consult with you, and we can talk about whatever your symptoms are, and I can make you a specialized tea that is going to focus on whatever it is that you are going through as a male. So if you're having these problems, or ladies, if you want to reach out to me and get a herb or the stimulator for your guy, reach out to me. Tell me what kind of symptoms he's having, and also this particular tea is for preventive measures as well. So if you're having any issues or not, you can still take this tea to prevent any, especially with the reduction of your libido and muscle mass and stuff like that. That is something that you're gonna have to do as far as exercising and stuff like that to boost that up. But if you are having any of these symptoms that I described, I can surely assist you on your journey and just reach out to me. Okay. All right. So, guys, that is all I have for you guys. I just wanted to come on here and share this with you. I thought it was very, very important for men to know that what you are experiencing is something that is real. It's something that's real. It's something that's true. It's not in your head. You're not just having brain fog for no reason. You may be going through andropause, which is um, male pause, as they say. All right. So just want to thank you guys. I have been on here a good minute, about 30 minutes, guys. If you don't have any questions, or if you just want to reach out to me later with questions, I can do a quick consult and provide whatever it is that you guys need when it comes to the tea. All right. But I just want to thank you guys for showing up and coming on here for this segment. I will have another three. I guess I don't know if I'm going to do another series or not, guys, but I will be coming back on later on throughout the week and sharing some more health tips with you guys. And I am just going to say bye for now. Thank you for tuning in and tapping in to Feminine Health and Wellness. And